Welcome back to the Greg Schreffler Show, where I talk about anything and everything that has God in it. Why? Because I gotta, man. Well, I hope you enjoyed the creepy introduction, creepy music there. It's going to help set the tone for what we're getting ready to talk about. That is by, let's see, the name of it is Horror Background Music 2 by Delo Sound at pixabay.com. All right, so in episode 4 today, our topic is sexual corruption or natural as nature. We're going to be covering homosexuality, bestiality, transgender, gender identity, drag queens. Bet you're not hearing that from the pulpit, are you? But don't worry, this isn't going to be a cultural rant. It's going to be a biblical conversation. As always, the disclaimer is you already know where I stand on the subject since you know I'm a Christian. Nevertheless, I'm going to bring this to you, matter of fact, just presenting data to you. With one caveat, some of the words that these articles use are so soft about something so horrendous. So I will be inserting another word that means the same thing to help you better understand what is going on or what is happening here. And you'll know what I'm talking about when we get into it. But since this is such a life-altering event or change, I can't just gloss over it. I can't just throw it out there like it's no big deal. Besides, whenever you go to buy a car or buy something, you want to know everything there is to know about that product, and you want to make sure you get the best value for it. You want to talk to people who've already maybe purchased it or own it, and what do they think about it? So yeah, it's important enough for me to sidebar on it. I will do that. So let's just get into it. There's a lot of research here. There's going to be a lot of stuff for you to click on. So enjoy that. So let's start with definitions in our first segment here. Let's start with definitions. Like, what's the definition of a drag queen? So we're going to get all on the same page with our definitions, and then we'll get into the meat of it, or in some cases, no meat. Anyway, drag queen, a person, often a gay man, who dresses in highly decorated women's clothes, wigs, etc., to perform. This is a Cambridge Dictionary definition. The next word is bestiality. The definition of that is sex between a person and an animal, also Cambridge Dictionary. Next one is homosexuality. Romantic or sexual attraction or behavior between members of the same sex. That's Wikipedia. Definition of transgender, often shortened to trans, refers to a person whose gender identity is different from the sex they were assigned at birth. I need to spend a minute here to kind of break this down a little bit more, so bear with me. Sex assigned at birth is based on physical anatomy, male, female. Gender identity is a person's internal sense of being male, female, both, neither, or somewhere along the spectrum. So, a transgender woman is someone who was assigned male at birth but identifies as a female. And a transgender man is someone who was assigned female at birth but identifies as a male. Now, the definition of gender identity, also from Wikipedia. Gender identity is a person's deeply held sense of their own gender, whether that's male, female, a blend of both, neither, or something else. All right, so there's some key points with this, and we got to look at that. The key points are, it is eternal how someone feels about themselves, not necessarily how they look or what body they were born with. It can align with biological sex, which is cisgender, or differ from it, which is transgender, non-binary, etc., etc. The gender identity community has 72 genders for now. It typically develops, they say, in early childhood and becomes more deeply rooted over time. Now, we're still under the transgender definition here. There's some important distinctions. Gender identity and sexual orientation. So gender is who you are. Orientation is who you're attracted to. Gender identity and gender expression. You may feel male, but express yourself in ways culturally seen as feminine. and vice versa. And last definition we'll cover is mutilation. This is an act or instance of destroying, removing, or severely damaging a limb or other body part. That's Merriam-Webster. Mutilation or maiming, from the Latin mutilis, is severe damage to the body that has a subsequent harmful effect on an individual's quality of life. In the modern era, the term has an overwhelmingly negative connotation, referring to alterations that render something inferior, or dysfunctional, or imperfect, or ugly. That's Wikipedia. And one more. The act of damaging something severely, especially by violently removing a part. And that is the Cambridge Dictionary definition. Okay, so there you have it, the definitions of what we're getting ready to discuss. So this next segment, we're going to look at procedures. What does it take? The first one is male to female. It's called vaginoplasty or penile inversion technique. This is the most common method. And here's a step-by-step breakdown. Removal of the testicles, also called orchiectomy. Okay, the testicles are removed. The scrotal skin is preserved to help create the labia majora, or outer vaginal lips. Now here's one of those words I was mentioning earlier. Number 2, disassembly. See, that's very soft. Disassembly. Like disassemble your bike or disassemble your Lego set. But to disassemble your penis, I don't think that's a fair word. So let's use the word that we know is more accurate, and that is mutilation. So instead of disassembly of the penis, let's use mutilation of the penis. Now you tell me if I'm being too strong here. You tell me, because this is what is involved in it, okay? Just imagine having a hot dog in your hand, and you're going to cut down the middle of it long ways, and then you're going to peel it open and around, all right? Now, just hang on to that thought as we get into this a little bit more. So, number 2 here. The penis skin is carefully detached. That's another nice word I like. You see, when I go fishing, I carefully detach the scaly skin of a fish from its body. I don't know that I've ever said that, but that's what I can say that's involved with. So the penile skin is carefully detached and inverted, which means what? Turned inside out. Turned inside out. So the hot dog, rip it open, and you keep rotating it around to turn it inside out. This becomes the vaginal canal lining. Number 3, creation of the vaginal canal. A space is surgically created between the rectum and the bladder. Now, I want you to keep in mind, I'm going to go through, I've front-loaded all this data with just listing to you the procedures and the actual science of it all, I guess, if you want to say. And the end of it, we're going to discuss what the scriptures say. But keep in mind, I haven't even touched on what God has to say about this. But what I want you to bear in mind is, how does this sound natural to you? So you got to let me know. Oh yes, it sounds very natural, Greg. Very natural. I don't see anything wrong with it. So let me know if that's what you feel or believe. All right, so we've got this surgically created space between the rectum and the bladder. The inverted penile skin is inserted into this cavity to create a depth of 4 to 6 inches. Number 4, constructing the clitoris. The glans penis, or the head of the penis, or as we used to call it, is the fireman's cap, which contains nerve endings, is reshaped and positioned to form a neoclitoris. Neo just means fake or artificial. This can preserve erogenous sensation. Number 5, formation of the labia. The scrotal tissue and remaining penile tissue are sculpted. That's a beautiful word, like it's a masterpiece, They are sculpted to form the labia majora and labia minora vaginal lips. That's what those are. Those big words just mean vaginal lips. Number 6, urethral repositioning. The urethra is shortened and repositioned for urination in a sitting position. I don't know why anybody would ever want to give up the ability to stand, to just be standing while you pee. That just, No, I'd never give that up. That is anyway. Sorry. Let's see. Yeah. Okay. Yeah. This can preserve erogenous sensation. Urethral repositioning. Like I said, the urethra is shortened and repositioned for urination in a sitting position. Post-surgical recovery. Recovery takes several weeks to months. Patients must use vaginal dilators daily to maintain the depth and shape of the neovagina. Now, I've affectionately called this or named this the ramrod technique. But I wonder scientifically if you could call it masturbation as well. But basically, what you will need to do on a daily basis, and oftentimes repeatedly throughout the day, is with your dilator, air quotes, is ram that thing inside of you repeatedly to maintain your sculpted vagina. Now, the reason that this is necessary is because the body has this natural tendency to want to heal itself whenever it's damaged. And your job with your Frankenstein vagina is to prevent that from happening. You don't want that to close up because then you have to have revision surgery. Okay. Now, again, I apologize if I'm coming across sarcastic. I really do apologize. I just, not even getting to the biblical portion of this, I just have to ask you how any of this makes sense. All right. So if you worship this stuff, I really do apologize. And like I said, my mind is so analytical and so logical. It's so hard for me to really read this and not, because everything inside of me is screaming something because of there not being any logic, and they're not. Anyway, never mind. Okay, so let's see. Complications can include infection, loss of sensation, narrowing of the canal, or need for revision surgery. So that's what we were just talking about. If you're not into the ramrodding on a regular basis, then you're going to have this revision surgery. And I have a question here when it says loss of sensation, and maybe one of y'all can help me out here. If you're having to continually ramrod your sculpted vagina to maintain your sculpted cavity, is there a possibility of becoming desensitized to this sensation? Let's move on. Now, some alternative techniques that are less common. The peritoneal vaginoplasty uses abdominal lining instead of penile skin. The colon vaginoplasty uses a section of the colon to create a vaginal canal. It's also used if there's insufficient penile or scrotal tissue for revision. All right, so everybody tracking? You got that figured out? Now the next thing we're going to look at is the female to male process. Okay, this one is over the top pro transgender or pro surgery. So, well, never mind. You'll figure it out. It starts off with there are multiple forms of surgery. You know, right there, I want to ask you, when you hear the word multiple, what number comes to mind? Think about that for a second and have an answer ready. There are multiple forms of surgery, including the removal of breasts, which is also known as top surgery, and the altering of the genital region, also known as bottom surgery. And that's it. So when you hear the word multiple, I mean, two wasn't what I had thought of as multiple. But technically, you know, more than one can be multiple, I guess. So I don't know. You tell me. I just thought it might have been sounded better if there are a couple of forms of surgery, but multiple, and you get two. Anyway, that's sidetracking there. So let's look at some examples of bottom surgery, not to be confused with your ass bottom, not that bottom, like your lower, the Netherlands, or not the Netherlands, the netherworld. Just, never mind. Hysterectomy, removal of the uterus. Vaginectomy, removal of the vagina. Metodioplasty or phalloplasty. This is the construction of a penis. I'm gonna keep going and hopefully you're paying attention here. All right, this next one is also a nice word here. Chest restructuring. Hey son, can you restructure your Lego set there? I don't know, it sounds weird. chest restructuring. But let me ask you, ladies that have had breast cancer and had your breasts removed, did they tell you you were going to have chest restructuring? I don't. It just seems like it's more chest mutilation or top surgery. Maybe you think I'm crazy, but I don't know. What do you think? You tell me. Here's another thing that this person that wrote this article is just so super sensitive about is calling this a person. A person this, a person that, a person. Now we've already classified this as a female to male. Even in the other article it just said patient, but this one just keeps going to person, which I just can't do. All right, this is a female. Again, I apologize if this is offensive to you. A female in transition may wish to have a mastectomy to remove breast tissue. The surgeon will also make changes to the appearance and position of the nipples. Meanwhile, testosterone replacement therapy will stimulate the growth of chest hairs. Removal of the uterus, ovaries, and fallopian tubes. A female may wish to undergo this type of surgery if they are uncomfortable having a uterus, ovaries, or fallopian tubes, or if hormone therapy does not stop menstruation. But a person, there's only one type of person that can have these things and experience these things. In a partial hysterectomy, a surgeon will remove only the uterus. In a total hysterectomy, they will also remove the cervix. Check this one out. A bilateral salpingo-oophorectomy involves the removal of the right and left fallopian tubes and the ovaries. No, I'm not going to repeat it because I'm thankful that I just said it without a flaw. Whew. Metoidioplasty is a method of constructing a new penis or a neopenis, artificial, fake. This procedure involves changing the clitoris into a penis. Not a person, a female will receive hormone therapy before the surgery to enlarge the clitoris for this purpose. During the procedure, the surgeon also removes the vagina. In the military, sometimes we call people a vagina or that you have sand in your vagina. But it just means that this person's really lazy or really whiny. It really doesn't have the same implication that this whole conversation does here. In addition, they lengthen the urethra and position it through the neopenis. To complete the lengthening of the urethra, the surgeon uses tissue from the cheek, the labia minora, or other parts of the vagina. The goal is to allow the person to urinate while standing. An advantage of the metoidioplasty is that the neopenis may become erect due to the erectile abilities of clitoral tissue, or maybe you could say clitoral tissue. A phalloplasty involves using grafted skin, usually from the arm, the thigh, the back, or abdomen, to form a neopenis. A phalloplasty results in a larger penis than a metoidioplasty would. However, this neopenis cannot become erect on its own. After a period of recovery, a female can receive a penile implant which can allow them to get and maintain erections and have penetrative sex. The disadvantages of phalloplasty include the number of surgical visits required and revisions that may be necessary, as well as the cost, which is typically higher than that of a metoidioplasty. And all this time, we're asking ourselves, is this natural? Is this normal? A female may decide to have a scrotoplasty, which is the creation of a scrotum, alongside a metoidioplasty or phalloplasty. In a scrotoplasty, a surgeon hollows out and repositions the labia majora to form a scrotum and inserts silicone testicular implants. Okay, so you got that? We got male to female, female to male. There's your procedure. That's what you can expect going in and I guess coming out too, yeah. So now let's look at some side effects in this next. 9 long-term side effects of gender reassignment surgery, which is another soft phrase for mutilation surgery, by Sakshi Moore. This is from May of 24, and that means the year 2024. Okay, number 1, surgical complications, risk of infections at the surgical site. That's no big deal because that's can happen to anything, any surgery that you have. All right, there is a possibility of needing additional surgeries to correct or refine the initial results. Procedures that involve the urinary tract, such as phalloplasty or vaginoplasty, can lead to complications like urinary tract infections, urinary incontinence, or strictures. Urethral fistula. This is a tunneled connection that forms between the urethra and another part of the body. Urethral stricture is a narrowing that causes a blockage of urine flow within the urethra. Some surgical procedures, particularly those involving pelvic region, can affect gastrointestinal function. In the long term, it potentially causes conditions like constipation or IBS, irritable bowel syndrome. You're asking yourself, is this normal? Number 2, hormonal side effects. Long-term hormone therapy can lead to cardiovascular issues such as an increased risk of blood clots, especially the older you get. Hormone imbalances might cause changes in mood, weight, and metabolism. Long-term hormonal therapy can affect bone density and lead to osteoporosis risk. This condition makes bones more brittle and susceptible to fracture. This is normal. Number 3, sexual health concerns. Changes in sexual function can include decreased libido or difficulty achieving physical satisfaction. Of course, that relates back to the ramrod thing on a daily basis. Are you being desensitized from having to perform that every day? Anyway, the potential for chronic pain or discomfort in newly constructed genitalia. Number 4, scarring and aesthetic dissatisfaction. Significant scarring or dissatisfaction with the aesthetic outcome of surgery can occur, sometimes requiring additional corrective surgeries. Number 5, fertility issues. Many forms of gender reassignment or gender mutilation surgery will impact, is the word that they chose. I like the impact reproductive capabilities. How about a more accurate word? Prevent reproductive capabilities. Then there's another nice word here. It says potentially leading to infertility. How about most likely leading to infertility? So it's a check the box to say that they covered this, they explained this, it's in there. But the soft words are there to help you gloss over it. Number 6, psychological impact. While many experience a significant improvement in mental health, I apologize, that's not accurate, as you'll soon see. Some may encounter ongoing struggles with anxiety and depression. That's only the beginning. You can have issues with self-image and acceptance. This is especially true if the surgery doesn't meet your expectations. I'm curious, what were your expectations going in? Number 7, risk of surgical revisions. Additional surgeries may need to correct or revise issues from the initial procedures, such as cosmetic imperfections or functional deficits. Think ramrod. We're still having to worry about that. Number 8, social and relationship changes. Navigating relationships can be challenging as individuals and their partners adjust to the physical changes. And I'm just curious how this is an issue, because this is what you wanted and you would have discussed this prior to the surgery with your partner, right? Or did you just come back and go, surprise? You discussed this, so why are there challenges? Potential social isolation, discrimination, or legal difficulties related to their gender transition can impact mental health. All that stuff can impact mental health, but what you just had done to your body will impact your mental health. Number 9, immune system response. In some cases, gender reassignment or genital mutilation surgeries, particularly those involving implant materials like silicone prosthetics used in breast augmentation, I like that, or testicular implants, can trigger a foreign body immune response. But if this is normal, why would that happen? This is because the body sees these implants as foreign objects. This reaction could lead to ongoing swelling, pain, and even the body rejecting the implant. It's important to watch for any signs of swelling or pain and see a doctor if these issues continue. In some cases, the implant might, which is totally bogus, It will need to be removed if the body can't adjust to it. Why would you put might? If your body can't adjust to an implant, it has to be removed. This is why it's crucial to consider the materials used in surgery and monitor how the body responds afterwards. All right, this is too much material to cover in one episode, unless it was to be an hour. And I really don't know if you guys are into doing that for an hour. Maybe you are, but that's a long time, and I know you're busy and your time is required. So what I'm going to do is I'm going to put a pause on it right here and do a to be continued next week. So this is like episode 4, part 1, and the next week will be episode 4, part 2. But anyway, stay tuned, and we will finish this up next week and pick up where it talks about increased suicide. So thanks for watching. Thanks for listening. Thanks for giving me your time. Thanks for your patience while I continue to iron this stuff out. And please leave me a review. Hit like, hit share, tell your friends, tell your parents, tell your enemies. Let me know what you think. You know, like, hey, Greg, you're being really harsh. Or, you know, no, that was pretty good. Anyway, just let me know. The data is what the data is. I can't change that. I mean, that's just the science of what you're planning to do to your body and what you can expect from this procedure. All right, thanks. So stay tuned, and we will be back to finish this up. Until next time, stay safe.